Have you also been hearing about stroke issues very often? आजकल बहुत ज़्यादा हम लोग heart issues and even stroke issues के बारे में सुन रहे हैं ना. Lot of people are getting stroke. So is it preventable? Yes, it is. In 80% of the cases, it is preventable. Because अगर आप जो high risk factors हैं उनको control कर लोगे तो definitely it is preventable. So let's learn and let's see what are the high risk factors and what you can do about it. सबसे इम्पॉर्टेंट, सबसे बड़ा हाई फैक्टर है इज द बीपी, दैट इज हाइपरटेंशन. अगर आप प्रोन हो हाइपरटेंशन के, या आपका वर्क जो है बहुत स्ट्रेसफुल है, या आपकी जेनेटिकली आपकी फैमिली में देयर इज अ हिस्ट्री ऑफ हाइपरटेंशन विद योर पेरेंट्स, दैट मीन्स यू आर वेरी हाईली प्रोन टू गेट हाइपरटेंशन, इजंट इट? सो हाइपरटेंशन मतलब हाई सोडियम इन द बॉडी. अब ये सोडियम कहाँ से आ रहा है? इज इट ओनली जो आप नमक डाल रहे हो खाने में, सब्जी दाल में, खाली दैट इज इंक्रीजिंग योर बीपी? नॉट एग्जैक्टली. व्हाट इज इंक्रीजिंग इज द इनविजिबल सोडियम विच इज कमिंग फ्रॉम द फूड यू डोंट इवन नो. से फॉर एग्जाम्पल, अगर आपने कुछ नमकीन खा रहे हो, आप रेगुलरली चाय के साथ कुकीज या बिस्किट्स खा रहे हो, आप रस्क खा रहे हो, right, or you're eating lot of things from outside, you're ordering food from outside, that is where the invisible sodium is coming from. एंड स्लोली ये बॉडी में बिल्ड होना शुरू हो जाता है. प्लस अगर आपका पोटेशियम कम है बॉडी में, यू आर नॉट ईटिंग बनानाज, यू आर नॉट ईटिंग बॉइल्ड पोटेटोज, यू आर नॉट ईटिंग एवोकाडो, सो ये सारी चीजें क्या है, इट्स क्रिएटिंग एन इम्बैलेंस. सोडियम हमारी बॉडी में हाई होता जा रहा है, पोटेशियम कम होता जा रहा है. एज अ रिजल्ट यू मे गेट hypertension, though there are many other factors about it, but one of the major reason is that. So if you correct your diet, you are going to eat, the home cooked meals, and you're not going to do a lot of packaged foods, and you're trying to de-stress on a regular every day on a regular basis, then the chances and the probability of hypertension कि आपका BP high रहेगा या out of control चला जाएगा, वो थोड़ा कम हो जाएगा, right? So first risk factor is your BP. So keep a check on your BP. If required, see your doctor regularly. Keep a check कि कितना आ रहा है regularly, and then you have to see how to control it through various ways and means, because you need to know from where is it coming and why is it coming. Now 2 is also LDL factor. Now LDL जो है आपका low density lipoprotein, that is a part of your lipid profile. अगर वो higher होता है, then also you are at a very high risk of strokes. Similarly, diabetes. So if you have PCOS, or you have insulin resistance, or you have diabetes in the family, or you got gestational diabetes, try to immediately control, because that is something which you can control very easily by regular workout, right kind of food, including protein in each and every meal. So you need to just learn how to manage that. If you manage the diabetes and your sugar levels are in control, there are no spikes, there is no that your medications is not just going higher day by day, definitely you're at a lower risk. Another factor what we have seen is people who are smoking, who are having a lot of alcohol, and people who are sedentary worker. So smoking hai to quit karo, because you definitely don't want to land up into hospital because you're smoking, right? Alcohol, restrictive, okay, but if you're overdoing it, you have to stop. And if you're a sedentary worker and your job requires to be so that you have to sit at one place for a longer time, you have to put an effort to get up, do slight stretching, just walk 100, 200 steps, ideally 500 steps every hour. But you have to put that little effort to see that you don't come into that category of high risk of stroke, right? Along with that, some kind of exercises, de-stressing, meditation, and deep breathing exercises are also very important, because ये आपके hypertension, आपके BP को भी control में रखेंगे, ये आपके cholesterol levels को भी control में रखेंगे, आपके stress levels को भी control में रखेंगे. These are very easy things. We just have to make into a habit. तो एक एक करके एक habit बनाओ, right? So first thing कि चलो मैं biscuits कट कर देता हूँ चाय के साथ या कॉफी के साथ, whenever I'm having biscuit or I'm having rusk with my chai coffee. So first week में 1 week one change. Then second week में you can say कि okay, I will try to get up every hour. If not every hour, every 2 hours I'll get up and I will walk. I'll cut down my tea coffee to 2 cups in a day, and rest of the times I'll try to drink more water, or I'll include exercise. So one change is what you have to do. If you just do that 4 to 5 changes over a period of a month or 2, you'll definitely not be in that category of high risk of having stroke.